Hello and welcome to Impact the Borough, a podcast from the Greensboro Chamber of Commerce. I'm Brent Christensen, the President and CEO of the Chamber. Each week we'll highlight what we're doing to start and grow businesses, create quality jobs, and develop our workforce. We'll also check in with our community partners to share inspiring stories and important information from across our community. This podcast is brought to you by Truliant Federal Credit Union, a modern, mission-driven financial institution focused on the needs of its members, the businesses it serves, and our community. With 5 locations in Guilford County, including a dedicated commercial lending office at Friendly Center and a highly rated mobile banking app, Truliant makes it their business to help you grow yours. Visit Truliant.org for more information.
Hi, everyone. I'm Niketa Greene, the Vice President of Leadership, Diversity, and Inclusion here at the Chamber. I'm joined today by a panel of local experts to talk about something that's on all of our minds right now, COVID-19 vaccine. We recently heard from our small business focus group that many employees don't feel they know enough about the vaccines and that there's a lot of information out there, probably on social media, no less. And today we're going to dispel some common myths and delve into the reasons behind vaccine hesitancy. So let's meet our panel. Dr. Vann, would you like to start?
Sure. Good afternoon, everyone. My name is Dr. Iulia Vann. I am the Public Health Director for Guilford County. I am in charge of the COVID-19 response for our communities. And since March of last year, we have been incredibly involved in everything COVID. We've started with COVID-19 case investigations and contact tracing. We moved into the testing environment, also support to our businesses, to our schools, to our universities, and many other entities around the community. And most recently, in the last 2.5 months, we have been one of the major vaccine providers in our community. And I am very happy and honored to be with you on this podcast today. Thank you for having me.
Thank you.
And I'm happy to be here as well. My name is Jodie Stanley. I am the Outreach and Education Coordinator for the city's newly named Human Rights Department. So our concern is really equity and access to the vaccine and COVID-related information. From the outset of the pandemic, we have been meeting weekly with immigrant community leaders to learn about what's happening on the front lines and what is needed. We're really excited about that. It's a model that is now being modeled in other cities, and they're picking it up and wanting to do the same because it's so effective. It's given us critical information to know how to translate information to address literacy. Our most recent project is a series of videos that was translated into 8 languages, and it's specific to the COVID vaccine. So those are ready to circulate today, and I'll make sure you all have them before we leave.
Awesome. Thank you.
Hi, it's great to be here. I'm Dr. Carolyn Harraway-Smith. I work for Cone Health, and I'm the Chief Medical Officer for Women's Health. I have 2 roles at Cone, and the first role is clinical, where I see patients in the office, so women really of all ages, and I still do obstetrics as well. And so we deal with obviously the patient population and their issues with COVID. But then in the second role, I work in an administrative role, working on quality and safety for the Women and Children's Tower and the Women's Service Line in general. And the way that fits into COVID is on the outpatient arena, making sure that our pregnant patients feel safe, with whether or not they should get the vaccine. On the inpatient arena, it's making sure that our hospital is safe to have patients feel that they're protected from COVID, and our staff feel like they are protected from patients who might have COVID. And then I've been working with the organization on getting the shot into Black and brown arms, and doing lots of talks in the community, making sure that people are aware that there are concerns of access and also historic trends in terms of why people might not want to get the vaccine. So I'm excited to be part of this conversation.
We're glad to have you. Thank you.
Hi, good afternoon. My name is Laura Garduño, and I am an organizer with Siembra NC. I'm excited to be here with all of you. Siembra NC is an organization led by Latinx people defending our communities from threats like ICE and wage theft. And we're focused on building grassroots power with and without papers across the state of North Carolina. And since the onset of the pandemic, we became a central point of connection to support systems for Latinx community members. And we started translating public health information into Spanish and making sure it reached deep into dozens of neighborhoods in several counties across the Triad. Some of the things that we've done have been Facebook Live conversations, workplace safety specialists, and focus on making sure that people knew how to protect themselves in the workplace, since most of the individuals in the Latinx community are frontline workers and essential workers. But we also helped raise tens of thousands of dollars for our COVID-19 Immigrant Solidarity Fund, and we were able to help over 350 families across several counties. And right now we are leading, again, a vaccination effort or information effort to make sure that people in the Latinx community feel comfortable making sure that they get a vaccine, making sure that they get in line, and that they are not disincentivized from getting a shot.
Awesome. Thank you so much. You ladies are all working really hard already in and of the community and doing important work. So I'm really glad that you're able to be here and talk with us. So let's get into it. Dr. Vann, I'd like to start with you. Can you give us an update on the vaccination effort in Guilford County? Like, who's eligible to receive the vaccine now?
Sure. Some members of Group 4 became eligible for the vaccinations, with the rest of Group 4 becoming eligible on April the 7th. So currently, part of that Group 4 members include anyone between the ages of 16 and 64 years old with one or more high-risk medical conditions for severe disease from COVID-19, and then also people living in group settings, such as those that are incarcerated, people that are experiencing homelessness or living in a homeless shelter. And then on April 7th, additional high-risk group members and other essential workers that were not included in Group 3 were also going to be eligible. And we continue to prioritize Group 1, which is our essential medical healthcare workers and long-term care facility staff and residents. Group 2, which are individuals over 65, and then Group 3, which is a variety of essential workers in our communities, manufacturing, grocery stores, our government, law enforcement, court system, and so on and so forth. So we are in an active 4 groups, 1 through 4, and we are ramping up our efforts for vaccinating, since these later groups include a lot of community members, and we just need to make sure that our capacity continues to increase as more and more people become eligible. We continue to receive allocations of vaccine from North Carolina DHHS every week. So we continue to have that very limited number of vaccines that we can distribute to our community through the health department. There are several different vaccination providers in the community now. So as we're moving along, more and more opportunities for vaccine are coming up with commercial pharmacies and, of course, our healthcare systems that have been doing a tremendous job in vaccinating our communities, our FEMA site that is now active, and other smaller pharmacies and private providers also coming live. We have, through the health department, 3 vaccination sites right now. One is in High Point at the High Point University Community Center. The second one is in Greensboro at the Greensboro Coliseum. And the third one is at the Mount Zion Baptist Church, also in Greensboro. All 3 of them are considered mass vaccination sites. And we are continuing to support those sites as we're moving along in these phases and in the prioritization group. So that's where we are as a county, but then also as a state, since we're following that framework that North Carolina Department of Health and Human Services have put together for us.
Thank you, Dr. Vann. It definitely seems like you mentioned ramping up. It definitely seems like those efforts have ramped up, and there are a number of sites that are available to us now. But I'd love to get into some of the concerns that people have about vaccine. In late November, the NAACP reported that only 14% of Black survey respondents trusted the vaccine safety, and only 18% said that they would definitely get vaccinated. Additionally, just in Houston alone, there's 500,000 undocumented immigrants in Houston, and yet experts there say that they'll likely be the last to get vaccinated for issues surrounding mistrust, misinformation, and immigration concerns. They're also oftentimes cited some historical things that have happened, like the atrocity of the Tuskegee experiment, and the exploitation of Henrietta Lacks. One of the things that it suggests, though, in a New England Journal of Medicine article, is that it's not just historical things, but ongoing, everyday structural racism that it's impacting Black and Brown communities in particular. So Laura and Jodie, both Siembra NC and the Human Rights Department are doing a lot of outreach with minority groups related to vaccine. Can you guys talk about some of the modern barriers to accessing accurate information for these residents? Like, what are some of those common vaccine myths that you're hearing?
I think that what we're seeing is similar to what's happening in the general population, where people who have greater access to high-speed internet are more comfortable handling, browsers, have access to an internet several different ways, are the ones that are going to have an easier time accessing both information and sources for where they can get the vaccine, right? And individuals who don't have access to fast internet or are not comfortable navigating a browser are going to be left behind. And so that is very much the case for the immigrant community and the Latinx community specifically. Especially, we saw that in the beginning where it was just, I guess, group 2 or 65 and up. Those are older people who are definitely not going to be comfortable navigating these systems. And in fact, Siembra NC conducted a survey in which we asked and were able to get responses from over 800 Latinx people across the state. And they all indicated that 52% of them indicated that they were more comfortable if they could make a phone call. And I think that this is important to highlight, because it's not that they just want to get on the phone to schedule an appointment, is that there are questions. They're not sure about this vaccine. And if they could get their questions answered by a person, they would make this easier, right? So some of those myths are, you've heard them all, I'm sure. It's a chip. Does it have the live virus? Am I going to get super sick after getting the vaccine? And then there's more extreme ones like, I heard that it causes infertility. I heard that it contains fetal tissue. There's even like things of like, this is the sign of the devil, or you're going to be left with a mark of the devil. Like very strange allegations or suspicions around this vaccine. So what we found is that having conversations with people is really effective at changing people's opinions. And so some of the things that we're seeing are happening is that there is a lot of information on social media, right? And some of it is complete misinformation. And then there are other agencies that are doing a much better job at putting out accurate and reliable information. I've seen several Facebook Lives on social media platforms. But again, anyone who is not on social media and does not have access to internet and is not going to be sitting through a 35 to 45-minute conversation on a vaccine is going to be left out. And so what we've been doing is we've been talking to individuals at their doorstep, talking to individuals outside of ethnic markets, so that they engage in a conversation. And it can be a quick 5 to 7 minute conversation, but in the end we find that to be much more effective.
Yeah, Laura, that's a really good synopsis of what's happening in so many of our communities. I think some of the challenges that, in addition to access to technology, Black and Brown communities are more likely to live in poverty. So you're looking at transportation challenges. It's hard for them to get to a site to get the vaccination. You're also looking at something as simple as taking time off of work. Many vaccination sites are operating during work hours, and it's hard for people to get away from work to get to the vaccination site. Many of them have families, and they don't have anyone else to take care of their kids when they go to get the vaccine. So there are just a host of different challenges associated with poverty, I think. In addition, you've got documentation requirements, and I know that Laura is really familiar with this. We have a number of our immigrant and refugee community is undocumented, and for them, a relationship with any system can mean or lead to deportation. At least there's a lot of fear and mistrust, which is understandable. So when you think about the registration that's required to get the vaccine, that alone can create a barrier. So I think it's really challenged some of us to think on a broader level, more systemically, about how we're setting this up to succeed. Just a couple other myths that we've heard. One I heard today was that the Johnson & Johnson vaccine isn't working. It's not effective. Our response to that is that all 3 vaccines are effective in preventing hospitalization, which is the whole point of vaccines. Another one we've heard is, from a faith perspective, it's sort of this idea that God will protect me, or maybe even I'm taking this home remedy, so I don't need the vaccine. And the best response there is not to necessarily shame or be like, I can't believe you think that. It's really to acknowledge and inform, and like Laura said, keep the conversation open. Something else that's come up for our Muslim community are the products in the vaccine, halal or kosher. If they contain a gelatin product, they can't have that in their system. And so we've had to go through that. And the answer to that is yes, they're completely safe. They do not contain pork products. And many faith leaders have stepped up to say that it's okay to take these vaccines. Making sure that residents know that they can request an interpreter, that's been a consistent challenge on the front lines. And also, again, for a Muslim community, if they're concerned about modesty, they do have the right to request to take the vaccine in private. That's been a huge one. The other thing is that there's a cost associated with the vaccine, and that's not the case. The vaccine is free, and there's no insurance required. There is one registration site that I'm aware of that offers like a drop down of insurance options, but it's not a question that you have to answer, so you can kind of skip it over. But it's caused some confusion. But just letting people know that insurance isn't required has been a big part of our conversation.
Oh, yeah. Thank you. And both of you make me think about, again, an article that I read talking about kind of this issue and how important trust is, and even suggesting that maybe, for some communities, hearing from people that are already in and of their community is important, and kind of dispelling some of that mistrust. Dr. Harraway-Smith, Dr. Vann, do you have any thoughts about myths or anything different that you'd like to share about that?
I think in some situations I've heard lots of conversation about the mistrust, and there is we know that there's mistrust, but on top of that, I think the access issue is just as great. And so I've urged people in our healthcare community not to sit on or rest on the fact that there's this distrust and then not do our job by getting the vaccine out at the times and at the places that people need it. And I think that's that's one of the bigger issues that I see. I think the mistrust issue, as we've gotten further along, when people hear, just like you said, from people who look like them, people who understand their experience, that not only do they recommend the vaccine, but they've had the vaccine. For example, I'm not a huge poster on Facebook or social media, but there I am, getting my shot on social media, talking about, the amount of fat on my arm. But it's because I wanted people to see and hear that not only am I recommending the vaccine, I'm putting my actions where my mouth is, and I'm showing you where I'm getting the vaccine. And I think a lot of professionals of color have done the same thing, just to let people know we're out there, and we want you to see that we're out there doing what we're recommending for you.
Thank you so much, Dr. Harraway-Smith, for that. You are absolutely right. And I've done that myself with the time when I took the vaccine, to just kind of lead by example, but then also follow the recommendations of the framework, and waiting for my spot in order to get the shot, since I did not qualify to get it until we were in group 3. So, just kind of making sure that happens also. So some of the myths and the misinformation that Lori and Jodie have shared with us are very similar to the same ones that we're hearing, with a few additions that I didn't hear before. So that was definitely very interesting. From the Latinx community perspective, I think that one of the areas that we want to continue to communicate is that we are true allies in these communities, that we create safe spaces for everybody to come and get their vaccine. We do have a registration process because the vaccination is still a medical act. We are still giving a medication, and we need to make sure that we have the right person that we're giving the vaccine to. But we're not asking for ID. We're not asking for Social Security. We're not asking for insurance cards. So trying to continue to communicate this, I think that is really important. And the health department has been an ally and a friend for these communities for decades now, and we continue to do that. We have support in our clinics from the National Guard. And that is another area of concern in these communities, because they see people in uniform and they think ICE. And of course, they're scared to come, but they're really an amazing partner in trying to make this work. And we don't always have the capacity of the people to be there and actually do this work. So any type of support that we're getting from these partnering agencies, we're very happy to have them. And they're supposed to wear their uniforms. We tried really hard to work with the National Guard to try to ask them, hey, can you wear maybe a polo shirt or maybe some khakis, and not really the uniform, but unfortunately that is part of their mission in being there. But I think that just telling our communities that we don't want to make them feel unwelcomed, and we're doing everything that we can to create this safe and friendly space for them to come. We also hear a lot of, and this is one of the myths that I think I've been talking about the most, is the fact that these vaccines have been developed way too fast, with too much too little time. And I think that it all started even with just like Dr. Corbett mentioned in one of the speeches that she had at the NCANT, that even the name of this project, which was Operation Warp Speed, made it automatically seem like, yeah, this is way too fast. This is happening in a way that is going to cut corners. No way that, this is going to happen in the right way. But one thing that I keep mentioning is that these vaccines have been built on years and years of research that our scientists and our medical and scientific community has worked around. The mRNA vaccines, as well as the Janssen vaccine technology, they've been around for many years. Ebola vaccine has been around for 2 years, and it has been successfully used in preventing Ebola outbreaks. And it's based on that same technology. So it has been work that has been built on years of scientific research prior to that. It also received a lot of funding that these groups have never received before. So when you have $10,000 to build a house, it's going to take you a whole lot more time to build that house than when you have $2 million to build a house. You're going to build that house in 2 weeks because you have the materials, you have the contractors, you have the minds that are all coming together to build your house. So this is kind of that same type of work that was done on that foundation that was laid out. So continue to share these analogies and some of the fact that we realize that even the terminology that is used may not have been the best choice when we're trying to build this trust in our communities. We also hear about DNA, the DNA being affected, or our own human DNA being affected by the vaccine, and talking more about how the vaccine actually work in our body, and the fact that there is no touch points between that little piece of genetic code from the virus that comes into our cells to try to make these proteins and the protection that the body has for our own DNA. So it's just really that response that we're looking for, so our own immune system would be able to identify the virus. I think that another area that I'm sure that Dr. Harraway-Smith will be a whole lot more equipped to talk about is really that infertility or fertility issues that we're also hearing coming out of these communities.
As an OBGYN myself, we have zero evidence that that is the case. I'm really not even sure where that came from. But again, this vaccine does not affect the DNA, and it is not a long-lasting virus. The viral particle, not the viral particles, but the parts of the vaccine that are not active are not in the system after even 30 days. So there's no effect on the egg. There's no effect on the developing embryo. There's no effect on the pregnancy that we've seen. And we have lots of pregnant patients who've been vaccinated. We have not seen any adverse side effects in pregnant patients. However, we do know that if you're pregnant and you get COVID, that your chances of getting sick and being hospitalized is a lot greater. So we are recommending that pregnant people, for that reason alone, get the vaccine, and in fact, be made high priority for getting the vaccine.
You know, the long-term effects, that is another myth that we're hearing, and some hesitancy because they don't know, our community doesn't know what will be the long-term effects, side effects of the vaccine. So just bringing, you know, conversations of all of the years that we have behind the vaccine research and behind the vaccine science has showed us that vaccines in general do not lead to long-term side effects. There are some of those very short-term side effects, and even there I can break that down, because there are true side effects and the actual body reacting to the vaccine and starting to work. And if you have a headache, or if you have, you know, maybe feeling yucky for 24 to 48 hours, it's really not a side effect. It's just showing that your body is working to protect you from the virus. So just talking about those things in a way that everybody can respond to them. You know, when we receive our measles, mumps, rubella vaccines that, you know, everybody's getting, you know, we're not really worried about long-term effects of that. Or when we're getting our other vaccines for tetanus or pertussis, you know, they have been embedded in our society, and they have prevented millions upon millions of deaths and disease that we're not really thinking about long-term side effects. But now, because this is truly a little bit of a shift in the way that our community is being educated, it's important to continue having those conversations. So a lot of a lot of the work that we need to do is really putting out the right information, working with our community leaders, working with those trusted partners, because, you know, sometimes government is not necessarily being trusted, you know, all around. We can be public health and we might not have anything to do with any of the policies or laws that are being put out there, but we're kind of automatically grouped in that one bucket. So using our information and our materials through the trusted voices of our community members, I think it has been extremely important, and it continues to be important.
You're absolutely right. These conversations are really significant, and I mean, I'm learning something here as well, and I appreciate you all sharing your perspectives. I think, Dr. Vann, you raised an important point too about just that kind of the time frame of the vaccines development being a concern, and I thought it was interesting that Dr. Corbett raised that. I was listening to that conversation as well when she's at A&T. Maybe words do matter in a number of contexts, but so Dr. Harraway-Smith, can you talk about the different types of vaccines that are available and a bit more about how they were developed?
Right now, there are 3 separate vaccines, but 2 different types of vaccines. So the Moderna and the Pfizer vaccine are both mRNA vaccines, and I'll explain that in a second. And then the new vaccine, or the what we're calling the Johnson & Johnson vaccine, is a different type of vaccine. It is a viral vector vaccine. And so let's go back to the first vaccine that was developed and given this emergency authorization is the Pfizer vaccine. And the interesting thing about the Pfizer vaccine, when we look at kind of community fear of the vaccine, Pfizer did not use any governmental financial assistance in developing their vaccine. And then Moderna came, and Moderna did use some assistance only in the production of that vaccine, not in the development of it. And so what I like to tell people but there were persons of color on the development of that vaccine, which can give people some security in that. And so those are both mRNA vaccines. And so what they do is they take a piece of this vaccine and embed it into the cell. Now, the important part of this going onto the cell and making it think that it's the virus is that it does not go into the brain function of a cell, which is the nucleus. So there is no altering of the cell. Okay, so in order to change a cell, you really have to get into that mind of the cell, and that doesn't happen. And it doesn't in any way, shape, or form alter DNA. And I think that's an important thing because it doesn't affect the DNA. That's not how it works. The other thing is all of these vaccines, once they do their job, which is getting in there and making the body think that the virus is there, and so it builds up kind of an army against the virus, is the rest of that vaccine is then gone. It's out of the body within 30 days. So it's not, once you get the vaccine, it's in your body for the rest of your life. And I think that's what people think, and that is not the case. So the Pfizer vaccine requires 21 days before your next dose. The first 2, the Moderna and the Pfizer, require 2 doses. And this isn't a booster like you may have gotten from previous shots. This is to get a full complement of the vaccine, you need both doses. So for Pfizer, that's at day 1 and then at day 21. And there is a little wiggle room at the end, but we do recommend that people stay on cycle as much as possible. And then with the Moderna, it's 28 days in between. It is important for people to know that for those second shots, there are side effects for some people. Some people, regardless of their age, breeze through, they have a little soreness in their arm, and then they're over it. Other people have a few side effects that are worse. I'll tell you, when I had the vaccine, I was feeling fine until about hour, 8 to 9. And then after that, I was like, wait a minute, I am like exhausted. And I went to bed until the next day. And by probably 20 hours later, I felt literally rejuvenated and back to normal. So that does happen to people. And it is important that people are educated before they get the vaccine that this will happen. So there isn't that fear about maybe they're sick because of some, adverse reaction to the vaccine. These are normal side effects. In terms of the Johnson & Johnson vaccine, this is a different format. And this vaccine is in the form of an inactivated virus. And I think it's important when you use the terms inactivated, on none of these are live virus. You're not getting a coronavirus on any of these vaccines. So the Johnson & Johnson, which the benefit of the Johnson & Johnson is, instead of that 21-day lag and 28-day lag, you get one shot and then you're done. And the side effects on the Johnson & Johnson vaccine are less than the side effects for that second injection for the Moderna or the Pfizer vaccine. So that might be a benefit to people. And the benefit of all of these vaccines is really the same. The benefit and the goal is to decrease severe reactions to COVID. So hospitalizations and severe illness as a result of them. And they all work well in doing that.
And if I can jump in, I think that's been one question that we've had is which vaccine should I get? And our understanding is the best response is the one that's available because we have a limited supply. All three are effective. There are pros and cons, but we want to think about availability. Is that accurate?
That is accurate. And one of the things that I like to use as a carrot is reminding people that ultimately we want to get back to life as normal, right? We want to go to restaurants, we want to go to ball games, we want to play with our children, we want to visit our grandchildren, and all of the vaccines will do that. And once enough people are vaccinated, we will get to herd immunity. That means enough people have it that the virus can't really catch and affect the community. And all of the vaccines will get us to that point.
Absolutely, you're right. We definitely, we're a year into this, into the virus being here and us, realizing it, I guess. And I think now everybody, as spring is springing, people are definitely really want to get back to their lives. So can you talk a little bit about, how long after being vaccinated someone is protected, and when are masks going away in the near future?
Well, if I had that answer, I would be really popular and probably very wealthy. And we don't know when masks are going away. And I don't know that that's the question, right? Because I think if enough people get herd immunity, then we can at least get out and we can be with our friends and with our families. And right now, even for those who are vaccinated, we are recommending still wash your hands, still wear your mask. Now, if you're with one family who's not leaving their home and is vaccinated, then yes, the grandparents should see that family, but we're still not recommending large groups of people getting together. In terms of when are you fully vaccinated, about 1 to 2 weeks after that vaccine series, you can be considered, that it took, or that the vaccine is then effective.
And if I may just jump in here for just a second, because I think that Dr. Harraway-Smith just made a really good point and try to connect it for our listeners around the vaccine affecting the DNA and the fact that the vaccine leaves the body after, almost 30 days after it's done its work. You also hear all of this conversation and all of these discussions around how the vaccine needs to be transported in these ultra low cold chain freezers, and they're just so sensitive to the temperature. Well, that is also something that we can connect with the fact, well, once that vaccine gets in our body, the temperature of our body is denaturing the vaccine after it's done its work. So it's also linked up with that. So you can't leave the vaccine out on a table and expect for it to still be viable, because it's not. But then once it enters the body, and it does its work. It produces it helps the body produce those spike proteins. The temperature in our body is helping us make sure that those pieces are being destroyed and eliminated and they're out. So it's kind of like how do you get to eliminate the vaccine has something to do with how temperature sensitive they are. So I just wanted to mention that to make that link there.
Thank you for that, Dr. Vann, and thank you, Dr. Harraway-Smith. I think one of the things that we need a lot more of as we're being educated is we need to hear the science. I think that goes a long way with dispelling some myths as well. Jodie and Laura, can you tell us about your organizations and the outreach that you guys are doing? Are there opportunities that employers can share with their employees who might be immigrants or refugees?
There are a lot of different things that employers can be doing at this time. And just to share an impactful story, something that's really stuck with me at the beginning of the pandemic, we have a lot of our refugees work at a chicken processing plant that's several hours away. They learned quickly that their temperature would be taken, and if their temperature was above a certain point, they would be sent home and wouldn't be able to work that week until they were cleared. So they started taking Tylenol before they showed up to work. And I think for me, it really hit home, and it highlighted the need in the immigrant community for information. I think that's the number one thing employers can do for their employees is to inform and empower them. So I don't necessarily have opportunities for you, Niketa, but I do want to offer our office and myself as a resource. There's some really great things that we've been doing at the city to empower employees, and there's some amazing things that are happening in the community. Employers can share our videos in other languages. I'll share those with you all so that they're just a really great resource, really practical, and a way to start the conversation. Employers can exhibit leadership. If you yourself get the vaccine and you show your employees that you trust it, they're more likely to do the same. Some employers have set up a COVID vaccine FAQ site on their internal websites. That's a really great way to share information about the vaccine and kind of dispel some of those myths. Email employees the links on how to register. If you know your employees are more than likely qualified at that point, then let them know, inform them, encourage them that it's free and safe and documentation's not required. If you can meet them where they are, they're more likely to get vaccinated. DHHS, the Department of Health and Human Services, is offering Vaccination 101 trainings each Friday. Oh, wow. It's really exciting. Just learn about those today. You can actually ask them to come to you or to provide a training for you. So I'll make sure you have the link for that. But employers, that's a great opportunity to get information out to employees. I hope that's helpful, Niketa.
That's very helpful. That's great advice, actually. I appreciate you sharing that. Laura, do you have some things you'd like to share about outreach that you all are doing?
Yeah, absolutely. Like I said before, we are going neighborhood by neighborhood, door by door. So the same thing would be for workplaces. We can come to the job site and make sure that we are delivering information to employees in terms that are easy to understand, and provide a hotline number so that people can call and have that phone conversation with the person that can schedule them, but also dispel any kind of myths. I think employers can also recognize that workers having to show up to work during a pandemic are doing so, because they need to earn money to make a living for their families. And so employers should pay workers in order for them to take time off to get a vaccine. This is, if we want to make sure that workers do not put themselves at risk, do not put customers at risk, are not missing work, etc. We want them to be vaccinated. We want a healthy worker, their healthy family, a healthy community, and employers can pay them the time it takes to go get a vaccine, can pay them time off for when they have their second dose, or if they have just the one dose and they start experiencing symptoms or the immune response, that they can take that time to be off, to be well. And that might seem like an investment, but right, we want to make sure that we're creating trust and building long-term, good, solid relationships. And yeah, I mean, like we have these sources, and also if it's possible, right, make it so that people can come to the job site to register people for the vaccine as well. That's also very important because sometimes phone lines can be jammed, or the website, the vaccine appointments fill up fast. So if there can be people both in the Department of Health or people like Siembra who can sign people up for vaccines too, that would be better if it can be done on the job, and if there's other family members that can be benefited, right, as well, that the workers should be able to make sure that their family members, if they qualify, get in line too.
And if I could add very briefly, I think that's a great list, Laura. Kind of a question for you. Some employers were tossing around the idea of financial incentives for getting a vaccine. We just had a lot of hesitation about that. I think because of the historical misuse of brown and black communities in developing health, advancing health technology, there's a lot of concern about what it looks like when you're paying somebody. So alternatives might be to give them paid time off, or to perhaps pay a little bit towards their health benefits, because certainly it's just like working out or doing something good for your health. That's gonna make it better for everyone as far as your health insurance at work. So those were just some alternatives, but we were encouraging employers to stay away from the financial incentive.
I do think what I hear, I think from both of you, is just thinking about it at eye level, like thinking about where the employees are, what the needs are, and making it as convenient as possible as well for people to get information and even to get closer to getting vaccinated. So great advice, great information. Thank you. Dr. Vann, how can people make appointments to get vaccinated? We hope they're going to hear this and they're going to be inspired. So how can they make those appointments? And if you'd also talk about kind of how larger employers can arrange for vaccine drives on site.
Yeah, sure. So I'll start with the state website, which is www.myspot.nc.gov. So on that website, the North Carolina DHHS is trying to keep a very accurate list of providers and vaccination clinics that people can go to get a vaccine. So that's kind of like one of the bigger state level areas where they can go and look for who's providing vaccines in their community. Of course, through the health department, every week we release additional appointments as we're getting our allocation and we find out how many doses we're going to get. People can go to our website, which is www.healthyguilford.com, or call our call line, which is the 336-641-7944 number. So the website and the call center open up every week as we're adding more appointments to our clinics. In order to find out and stay in touch with that, even if this is not a way to make appointments, but it is a way to stay informed when appointments become available, I urge everybody to sign up for text messages by texting GC19 at 888-777 or GC19S at 888-777 for the Spanish version of the text messages. And through the text messages, we put information about when we release more appointments, or if an additional provider becomes available, if more groups become eligible. It's just a really quick and fast way to stay up to date on what's going on. Also, our new federally supported vaccination site in Greensboro also takes appointments. So to make appointments there, the website is www.gsOmassvax.org. And also calling the state line to make appointments. And I know that Cone Health is also taking appointments by calling their phone line, which I have to admit I do not know by heart, but that is also another provider in the community.
That email address is www.conehealth/vaccine.
Thank you for that. Also, we have
conehealth.com/vaccine. Sorry about that.
So www.conehealth.com/vaccine. We also have commercial pharmacies that are providing the vaccine. There are 13 Walgreens vaccination sites in Guilford County. This week, 3 Harris Teeter pharmacies became live. So more and more opportunities for our community members. As far as the employers asking for vaccination sites, we're working with our trusted partner that has been working with us since March of last year, which is StarMed or Starmount, to try to link businesses with vaccine opportunities, specifically for really large employers. Since the health department is really working those 3 mass vaccination sites, we don't really have the bandwidth to also go on site to provide the vaccines, but we have a really good relationship with StarMed, and just this week we were able to link them to a couple of large employers in the community. So let me know and I'll be more than happy to make that connection. Also, large employers that have occupational health and they have resources within their entity, sign up to be a vaccine provider. Do it yourself, do it for your employees. That is also an option. And if I need to help them connect those dots and make those connections, please feel free to reach out to me and I'll be more than happy to point you in the right direction on how to become a registered provider so you can administer the vaccines yourself in your agency.
And we have so many large employers here in Guilford County. That's great. That's a great resource. I'm glad that you shared that. This has been wonderful. You guys have shared so much information. We're going to put all of the resources that you've mentioned today on our website, which is greensboro.org/vaccine. So people will be able to listen as well as access that site to get the resources that you all have shared with everyone today. You've given our listeners, I think, a lot to think about, and I think you've shared information that arms people with the tools that they need to make the best decision for their health and for the community. So I appreciate you being here. I appreciate your time. It sounds like you are doing a lot in the community. So taking that time away to spend with us, to continue to educate the community has been great. So I appreciate your expertise and your insights. And I thank you so much for joining us today.
This podcast is brought to you by Truliant Federal Credit Union, a modern, mission-driven financial institution focused on the needs of its members, the businesses it serves, and our community. With 5 locations in Guilford County, including a dedicated commercial lending office at Friendly Center and a highly rated mobile banking app, Truliant makes it their business to help you grow yours. Visit truliant.org for more information. You can find all of our episodes on YouTube thanks to our video sponsor, North State. Make sure to subscribe so you'll get new episodes delivered to your device each week. You can follow us on Instagram, Twitter, and Facebook @GSO Chamber. See you next time.